I was embedded entirely in our crisis department. And so I spent about a decade in crisis services, seeing everyone from, kids who wouldn't go to school in the morning, moms would sometimes drive them to our office, to seeing people who had had really serious suicide attempts, to doing outreach with folks who had dementia. I'm a licensed mental health counselor and a geriatric mental health specialist. And, I worked in both outpatient and inpatient services in Seattle before I came here about 20 years ago. But I've just done a lot of different things here at Peninsula Behavioral Health. And as Kat indicated, PBH is actually a pretty big organization. Aside from the hospital district, we are the largest not-for-profit in Clallam County. I'm going to throw up my PowerPoint here, in part because I don't like to watch myself talk, but please feel free to interrupt me. I can talk for hours. I promise not to, but I'm really passionate about the work that we do. And I just want to share a little bit about the organization. So PBH was founded in 1971. There was a local doc named Norm Peterson who recognized that there was nothing in this community for people who had mental health or intellectual and developmental disabilities. And Norm just couldn't take that. So he founded this little not-for-profit. Back then, I can't even remember what it was called, had kind of an embarrassing name because we don't use some of those words anymore. That eventually became Peninsula Counseling Services, that became Peninsula Community Mental Health, that became Peninsula Behavioral Health over time. So, but we started with 3 staff and we just kind of keep taking on new things. Our mission is to provide comprehensive quality behavioral health services to the residents of our community. Not a super fun mission to put out there, not a lot of fun words. And when we say behavioral health, it's a little bit industry jargon, and it took me a while to realize other people don't know that behavioral health really means mental health services and substance use services under one roof. So we've had lots of words for all of those kinds of treatments over the years. When I got into the field, we talked about mentally ill, chemically addicted. We had dual diagnosis folks. The nomenclature changes over time, but when you see behavioral health, that's usually just an indicator that there's both mental health and substance use services happening under one roof. We serve about 3,000 clients a year in Clallam County. Our boundaries are to the Jefferson County line and out to the western border of Lake Crescent. And so that means we see about 1 in 20 residents on the east end of Clallam County every year. And I think that often surprises folks that we just come in contact with a lot of our community members. And that care might be a one-time crisis intervention service, or it might be prolonged mental health treatment services, or it might be a complex array of services depending on what that individual needs. Currently, we're at about 150 staff. We can't seem to get over that number. Anybody else aware of staffing challenges out there in the real world these days? Well, we have certainly been impacted by that. We have probably closer to 170 positions, and we float somewhere between about 140 and 150 staff at any given time. Our annual budget is about $14 million. And for those of you who are interested in community impact, the vast majority of that money is coming from out of the area. Our primary funder is Medicaid. So we see a lot of folks who are very, very low income, but we do take private insurance. We take folks who have no ability to pay whatsoever, and we scrounge money wherever we can. We're happy to come look through your sofa cushions if that works for you. We currently have offices in Port Angeles and in Sequim. You've probably seen our big office in Port Angeles over on 8th and Lincoln. People told me for years, I had no idea what was in that building. So we decided we should probably put some signs on it to let folks know. And we have a little tiny satellite office in Sequim over on 5th and Fur near the Boys and Girls Club. And we're actually going to be vacating that office at the end of April and moving literally diagonally across the street. So our current office in Sequim is about 2,000 square feet, and it's just not big enough. I have 6 teams that have to share that office. I have 3 staff who are permanently working there. And so there's just not enough room for us. So we bought the building directly across the corner on 5th and Fur that used to house the physical therapy group. So you'll see our signs going up there at the end of April as we get ready to move across the street. And I don't know if any of you have ever moved offices. I thought we could do this really quickly, but with fiber optic cables for internet and all of these sorts of things, it's actually quite the adventure to try to move across the street. So hopefully May 1st, we're going to be in our new location, but we'll be in the same neighborhood. And we're actually talking with another not-for-profit about potentially using that small office for their operations. We are governed by a volunteer board. It's a 501c3. And our current board president, does anyone know Russ? Russ Britton is the pastor at Dungeness Valley Lutheran Church. And he is one of the most dynamic, kindest human beings with a great sense of humor that I've ever met. So if you haven't had a chance to meet Russ Britton someday, I hope you do, because Russ is also one of the most articulate speakers I've ever known. He puts me to shame, but I'm just so blessed to have Russ as our board president, I think now for the 2nd or 3rd year in a row. Our vice president is a retired physician, Mary Ann Udy. Deb Reed actually just left as our treasurer. Deb has been a perpetual board member since the early 90s. She comes on for a few years. She goes away for a year or two. She just can't seem to stay away. Grant Monroe is in the timber industry locally, and he's our immediate past president. Dave Arand is with the Port Angeles Police Department. Patrick Erker is a local elder law attorney, and so he does a lot of guardianships and those sorts of things. So his work is adjacent to us. Dr. Christian, again, is another retired local physician. Vicki Lowe, you guys have heard of her, yes? So Vicki's on your city council. She's the head of the American Indian Health Commission. And Vicki and I know each other from way back because we've done some crisis intervention work in the past where I've called her from the ER at 2 o'clock in the morning and said, I have a Jamestown tribal member who really needs some extra support. What can you do? And Vicki showed up and put a plan together. And then March Picker, who is a mother of a current patient at our clinic, really just is involved with the organization because she feels like she needs to provide that support. And it also, we love having individuals on our board who have either personal lived experience or family members with lived experience. And I think that actually describes every single board member that we have at this time. So then we get that feedback too from our board of, are we doing the right things? Are we meeting the community need? So I'm very blessed to have a really amazing board of directors of PBH right now. So what do we do here? It's a long list. These are just kind of a few of the things that we do. We have individual, group, and family therapy. I think that's what most people would think of in terms of Peninsula Behavioral Health, is that we're, kind of the hub for therapy services. We provide psychiatric evaluation and medication services. So I have 1 psychiatrist and 5 psychiatric nurse practitioners on staff who review patients' medications. Hopefully we get to a point where patients are stable enough, we can refer that back to their primary care provider in the community. Sometimes that's not the case. We have a substance use disorders treatment program. We have psychiatric rehabilitative services, and I don't know what that means. Do you guys? What that means is we work with folks with the most severe and profound mental illness, people who have really profound schizophrenia, people whose lives are impacted daily by voices in their head telling them that the world is out to get them, those sorts of things. And we have tools and supports to help those people live independently in our community and to be successful. We have some residential treatment services. We have 3 supported living houses, some other things going on with that. We provide 24-hour crisis response to the east end of Clallam County. We provide 24-hour homeless outreach response in Clallam County, and that's new for us. Historically, we just operated during business hours, but we actually now have a homeless outreach team that can be reached 24/7 by phone and, to make a quick plan with folks and identify when we can follow up. And I don't know if you guys heard about this COVID-19 thing, but it taught us to use telehealth. we had been talking about telehealth for a long time as an organization. Is this something that we want to do? Is this really an effective way to provide treatment? And in March of 2020, all of a sudden we had to learn how to do it and how to do it really fast. So we have been providing telehealth services. Telehealth is not going to go away. It is not going to be our primary mode of providing care, but is certainly an option for us to be able to reach people who otherwise can't make it into services. I've been in this industry for a long time, and I keep hearing about how telehealth is going to solve everything for rural communities. Anybody live on Bell Hill? I can't see all of you. If you live on Bell Hill, you know that broadband infrastructure isn't great there. You would think that, you know, in this era, in that nice of a neighborhood, that we would have the ability to have really good broadband connectivity. It's just not the case. I shopped for a house a couple of years ago, and one of the things that really surprised me was how difficult, how many places there were where there's just no good internet service. And if you don't have good internet service, telehealth doesn't really help you unless you have a really, really strong cell connection and your cell connection is super stable. Sometimes you can get away with that, but there's lots of pockets in our rural communities that are just not connected at all. My medical director actually bought a house. I looked at he bought it and I said, oh, we didn't buy that house because you can't get broadband there. And his face fell. Wave has since managed to get out there after he's been in that house for about 4 years. So, you know, there's still lots of pockets where telehealth isn't the answer. It is certainly a tool that's in our toolbox now that will never go away. I think that that's probably going to be true for healthcare across the spectrum. Part of whether or not that works is driven by whether or not the federal government will allow reimbursement for Medicare and Medicaid. Many times our outpatient clinics, like OMC's clinics, North Olympic Healthcare, it's really driven on what will the federal government pay for, because insurance companies then mirror that as well. So we do a lot of different stuff at PBH. And then right before that happened in March of 2020, we submitted this big grant. We submitted a grant to become a Certified Community Behavioral Health Center of Excellence, or a CCBHC. You guys can say that 10 times fast. It's super fun. CCBHCs are expected to have a whole host of services connected to them. The idea is for people who have really serious behavioral health needs, they're not always good at connecting. If I say, hey, Kat, I need you to go down to DSHS and get signed up for food stamps, 25% of the time, Kat might do that. But the idea of the CCBHC is that we have a lot of people who just aren't ever going to access all of the resources available to them. And how do we build that all in one place? So literally the Friday before COVID really hit, we submitted this federal grant. And we were really excited. It's a couple $1 million for a couple of years. And for us, that's a lot of money. And it would allow us to expand care, add new positions, build out some more sophisticated infrastructure, bring in more evidence-based care, so data-driven psychiatric care, and increase the intensive case management. And we were supposed to find out in June if we got it. And if we got it, we had to start at the end of August, and we had to be up and running by December. So on April 30th, they called and said, congratulations, you got the grant, you start tomorrow. You have until August to be fully operational, get all your staffing up and running and everything going. So we said, okay, we'll take your money. And so we built out primary care. We hired a full-time primary care provider at Peninsula Behavioral Health. We brought in supported housing and supported employment specialists. We built out a care coordination team that in our office we call care navigation. We built out intensive case management services for people who just needed a little bit more. And we did a bunch of training with our clinical staff on evidence-based practices, things like EMDR. Has anybody ever heard of EMDR? EMDR is this complicated, seems a little like voodoo. I don't understand the brain science behind it. It's eye movement desensitization and I think reorganization therapy for people with post-traumatic stress disorder. And for some people, it is life-changing. It can really help people get through the parts of trauma that are holding them back. impacting their day-to-day life. And it's been incredible watching our staff be able to get the training, which is very extensive and very expensive, to be able to provide that to those community members most in need. So we were super excited to get the CCBHC grant. And with that, we were able to expand who we're seeing. So our CCBHC grant requires that we cannot refuse care to anybody who doesn't have the ability to pay. We provide care to people with all sorts of mental health concerns, whether it's anxiety or depression, post-traumatic stress disorder, schizophrenia, and everything in between. We see quite a number of local veterans. We have several contracts with our local VA. We also see people who have all kinds of health insurance. And right now, it's been really hard to recruit licensed providers who can bill insurance. So for many people, we're not billing their insurance at all. We're just using grant funds and other resources to help offset that care. Anybody know anyone who has a high deductible health plan? I do. My health plan doesn't really pay for anything until I hit that deductible. Unfortunately for me, that deductible in my clinic is only about $2,500. But if you buy your health plan out on the open market, it's not uncommon for you to have a $6,000 deductible. So basically you have no health insurance until you meet that, except for your one preventative care visit a year. So we actually work really hard to bring in grants and things like that to be able to pay for people's care, which helps them ultimately meet their deductible, which allows them to access other health care. But I do want to say, as it relates to our CCBHC grant, one of the biggest impacts that we've seen is bringing primary care to people who've never had it before. Our primary care provider, Christine, was formerly at North Olympic Healthcare Network, and they let us steal her. They were very nice about it when it all happened. We try to be nice in this community when we steal each other's staff. But Christine has found cases of skin cancer and breast cancer. Did you know there are no documented cases anymore of hepatitis C in Clallam County? Well, we found 3. She has helped somebody who has an abdominal tumor the size of a basketball get into surgery. And this is a woman who'd literally never been into a primary care office. We provided pap smears to women in their 50s who've literally never had a pelvic exam because of the history of trauma, because of their inability to walk through that door at that clinic. They've just not accessed care. So I think one of the most impactful things that we've done is really focus on bringing primary care to a very small portion of our population. Remember, I said we serve about 3,000 people a year. I think we're providing primary care to about 100 or 150. Our average patient is still going to Jamestown or Known or OMP for their primary care, just like you and I are. But there's a small cohort of people who are just getting missed. And we've worked really, really hard to wrap that care around those folks. I always like to tell people why we're important. I know this Soroptimist is typically women in business. And so I want to tell you why we're important to business. Because in the old days, and this was before COVID, the National Institute of Mental Health said about 1 in 5 adults have struggled with mental illness at some point in their life. Untreated depression and anxiety result in decreased productivity and attendance. People don't get along with each other as well if they don't feel good. Untreated mental health and often leads to untreated substance use, and that can increase in healthcare expenditures for an employer. So, the services and care that we provide really make a difference in whether or not somebody can successfully continue to be an employee oftentimes. This is probably too much and a lot of little squiggly lines to see, but this is some information from our state regarding kind of the status of behavioral health. And I think that these were the most recent ones that were published in February. And there's lots of colored lines, and I want to use my finger to point. That's not going to help you. But you'll see that, the emotional distress graph is kind of up and down and all over. And, you will see that peak and valley sometimes with the ebb and flow of what's happening with COVID. The other graph is Washington State started a Washington Listens line, and they're just there to provide some emotional support to folks as they've been stressed specific to the pandemic. And so their call volume has actually remained fairly constant across the pandemic. So they're seeing a lot of people calling in, asking for support, asking for information. What does this mean? You know, do we have to continue to mask? Do I have to wear a mask on an airplane? Are the really common questions right now. But I think, you know, it just highlights that there's been this kind of persistent level of stress in all of our lives. And I often describe it as everybody's cup is really, really full. And it doesn't take a whole lot added to that cup right now to have stuff start to spill out of that cup. I don't think that's going to change really fast. I think we're going to see that persist over the next few months as people just don't know. You know, we're seeing China lock down again. We're seeing our public health officer saying, yes, the CDC says you don't have to mask, but maybe you still should. And I don't know if you guys go to Costco and Walmart like I do, but you see a very mix in terms of people's response to the recommendations around masking and those sorts of things right now. Oh, I had this out of order. I'm sorry. I was just going to share a little bit about our economic impact, but I'm going to buzz by that because that's not very exciting. Just that we employ a lot of people at a lot of skill levels. As we jumped into our CCBHC, one of the most successful programs we launched aside from primary care was supported employment. And as an employer, I know that we have serious workforce issues right now, and we really want to help people find appropriate jobs. And our supported employment people have never been happier. There are jobs aplenty out there in the real world, and we're really working to connect people with jobs. And so for you and I, it's usually pretty easy to go out and find a job. For some of our clients who have more significant impairment, it takes a little bit more effort. If I'm an employer and I have a client who dresses a little bit weird, looks a little weird, might not have the world's best hygiene, and I have another candidate who looks like one of us on this call, I'm much more likely to hire one of us on this call than I am that person who looks a little bit quirky or might have need a little coaching around hygiene. So our staff are working to coach people on job skills, as well as how do you dress, how do you take care of yourself, how do you make sure you put on deodorant. Have any of you ever had teenage boys? I have two, and we have a phrase in our house. It's called "You stink, go take a shower," and it doesn't count unless you put on deodorant at the end. You know, sometimes folks with mental health, particularly serious mental health concerns, their ability to regulate temperature is a little bit off. And so they will often dress in layers when other people won't. And so they can be more prone to things like body odor. Also, have you ever taken a medication that has caused your body to smell different and you're not as aware of it? And so a lot of our folks with really serious mental illness have some body odor issues that are really kind of related to their psychiatric medications, and they're not aware of it. So we do a lot of coaching around some of those really basic skills in terms of getting jobs. And then we have folks that we're helping get into college and more advanced degree programs and things like that as well. So, but we can help both individuals get back to work as well as help businesses fill some of their vacant openings, of which everyone has plenty these days. If you know anyone who's open to candidates who would come from Peninsula Behavioral Health, we've got a great housing specialist, and we love to connect Harrison with potential employers. So I always like to share that. The other thing I always like to talk a little bit about is housing. So right now, PBH actually has a 19-bed assisted living. We have 3 transitional living homes that help support people to develop their independent living skills. And we offer some supported housing services to people who live in supported housing units with housing authority. But every time we do any sort of community needs assessment, whether it's through behavioral health or the hospital or the county, the number one thing is what? Housing. And over the last year, anybody's taxes go up this year? Their home taxes, mine did. My tax assessed value of my house went up $150,000 from the year that I bought it, the year prior, 2020, to last year. So I saw a big tax hike last year. And so it's increasingly difficult to own a home locally. We're actually seeing our biggest trend in new homeless in our community is women over 70, which is heart-wrenching, but we're pricing folks out of their homes right now. So we like to dream a lot about adding more housing stock to the community. So last summer, Lindsay, I'm going to say I always want to say Schwarman, and I know I get that wrong, from the PA City Council. He says, just call me Lindsay. Lindsay called and said, have you thought about this motel up there? Could that be housing? And so I called Randy Johnson at the county and I said, hey, there's this motel that's for sale. What do you think? Could we buy that and turn it into housing? Do you have any money? Can we get some money from you? So a group of us got together and we hatched this plan to turn the Allview Motel, which is up on Lordson by the library in Port Angeles, into housing. And we applied for a grant with Department of Commerce, and we got a $2.9 million grant that they're very kindly increasing to more like a $3.2 million grant to convert the Allview Motel into permanent supported housing for folks with mental health and substance use disorders who are very, very low income. So we have a large homeless population, and really Commerce wants us to focus on getting people off the streets. So the city of Port Angeles and the county, before we had the grant, said, okay, we have faith in you. We're going to just buy the motel for you and you can pay us back when you get the grant from the state. So we did get the grant from the state, hallelujah. And then we had a little issue back in December. You guys remember when it got really cold? Yeah, we didn't have any power up there right then. And the water was still on. And so we had pipes burst. We have water damage in about 10 units. But that allowed us to find some gold in that building. And by gold, I actually mean asbestos. And so it really gave us the opportunity to build out that building better. So we're tearing out all of the materials that we have now since found that have asbestos in them. We're getting all of that out of there. We're tearing it down to the studs. And we're going to rebuild that little 20-unit motel that also used to have a costume shop. Does anybody else remember the costume shop? There was a little costume shop in there. You could rent Halloween costumes. That's been gone for a few years, but we're going to make 3 2-bedroom apartments for families, 5 1-bedroom apartments, and 18 studios. We'll have one of those 1-bedrooms will be dedicated to a live-in resident manager who's going to get some training in crisis de-escalation and mental health first aid, and can help unclog a toilet and call our maintenance team if there's true maintenance issues, and collect rent and those sorts of things. And our board just decided last week that we're going to call it the Dawnview Court Apartments. And so the Dawnview Court we're hoping will be open in July of this year. So creating 26 units of housing, we anticipate will probably house about 40 people on that side. 4 of those units have been designated as transitional housing for our participants in our local mental health court program. Over the last 10 years, Mark Nichols, our county prosecutor, and I have been talking about putting together a mental health therapeutic court. And it's actually happening in 2022. We did a lot of work on it over 2021. They've hired a mental health court coordinator, who's one of my former staff, Birgit Tallman. And so we're going to be able to do some more diversion work in the courts for folks who are just routinely getting in trouble, largely because they're not taking care of their mental health needs. So I'm really excited about that. And one of the things we were told is it's not going to be successful unless you can build out some housing. So one of the questions I'm always asked when I come and talk to groups about mental health is, well, what can you do? Well, you can take care of your own mental health needs. First and foremost, take care of yourself. You know, when you're on the airplane and they're telling you when the oxygen drops down and you put it on yourself before you put it on the person that you're traveling with, it's because you can't take care of others and you can't support others if you're not first taking care of yourself. So, and we preach this a lot with our staff. We talk a lot about self-care because as a healthcare organization, it's been pretty tough. I mean, we've been through some tough roads while dealing with our own stress and anxiety with the pandemic. that in order for us to be there for other people, we have to first take care of ourselves. So the first and foremost thing that anybody can do is take care of your own mental health needs. Don't use a bunch of drug and alcohol. Bad coping skill. Drug and alcohol sales surged at the beginning of the pandemic. Nobody's really clear if people were buying a whole bunch of booze because they were afraid, they weren't going to be able to go to the grocery store. It petered off over time and went back to normal levels, but we did see big surges in alcohol purchases. Now people weren't going out to bars, they weren't going out to restaurants, so the alcohol sales in the commercial side dropped significantly. So were people drinking a lot more? We don't really know, but we do know it doesn't actually help your mental health to do so. Plan for a good night's sleep every night. Seriously, you know how you feel when you've had a really terrible night's sleep, or you stayed up way too late reading that really great book? I'm guilty of this. And you wake up the next morning and you go, oh my God, I don't want to get out of bed. It's going to be a long day. You don't feel good if you don't sleep well. So, we call it sleep hygiene in the healthcare field, but engage in good sleep hygiene, plan for a good night's sleep. It makes a huge amount of difference for people. Build in time for things that give you pleasure. I have a really busy job. I work probably 45 to 60 hours a week, depending. It's somewhat mitigated because I have to pick my son up from martial arts every day. So I'm forced to have some work-life balance. But I go home and what do I want to do? I want to clean the house. I want to do the dishes. I want to wash. I laundered all the sheets this weekend. It's really important for each of us to make sure that we're building in pleasure time. And I think it's been so busy and so stressful for so long that we sometimes forget to consciously choose to make time for the things that we love. And we all love different things. I love sewing, but I only love sewing at Halloween. I do Halloween costumes for my kids every year. They're 13 and 16, and I still make Halloween costumes every year. I don't want to do that all year. I have that planned, but I love a good book, and I can read a book in 2-minute increments. I have a Kindle. I prop it up while I cook. I'm a better person if I make time for those things that I enjoy. Connect with loved ones, especially those people who might be alone. Tidy up your house. And sometimes that's a big deal because living with chaos around you actually increases your stress level. It increases your cortisol. It doesn't make you feel good. And sometimes it's so overwhelming, you can't. I'm seeing in all your homes, they look pretty good. But but you never know what's on the other side of the camera, right? But seriously, I mean, if you have a space in your home that feels clean and calm and connected, again, it reduces that overall stress. And sometimes it's about scheduling. Okay, I'm going to create a plan for a month and I'm going to get there. I'm going to do the laundry room on this weekend. I'm going to do the kitchen this weekend. I'm going to do the bedroom this weekend. Kind of like you think about spring cleaning, just being planful about taking care of your space is really important. And you can also be supportive of others. When I say assume positive intent, do you know what I mean by that? Assume other people mean well. If I'm at the grocery store and Kat is a raging witch to me in the aisle, know that I have no idea what led up to that moment in her day. Give people a little bit of grace. Know that they, something probably got her to that point where her cup was overflowing so much that she had nothing left to give other people. And when the cart knocked into the display of crackers and 4 boxes fell on the floor, it may have felt like the end of the world for her, even though it looked like no big deal to you. Assume positive intent and know that you have no idea what led up to that moment in time. Ever judged a mom in the grocery store for how she was managing a kid's behavior? I was at the grocery store one time. My oldest son, I think he was, 4.5, 5. We got to the checkout line. I don't remember what it was about. I just remember him throwing himself on the floor, flailing and screaming. And the woman at the checkout station, looking mortified. And it had just been that kind of day. And I had to get groceries. We had to put food on the table. So I let him lay on the floor and do his thing. And then when I was done, she was done checking me out. I said, could I have carry out, please? And I scooped up my flailing kid, his arms and legs going like this the whole time, and carried him out football style. And I'm sure every other mom in that store was judging me. but it had just been that kind of day. And, my job was to get groceries and get my kid home safely. So kindness goes a long way. The Sequim mantra of be kind. Send a thoughtful note to someone. Everybody loves to get something in the mail that's not a bill or junk mail. So if there's someone in your life that you care about that you haven't talked to for a while, or is feeling a little bit lonely, a little note card in the mail goes a long way to turning that person's day around. Ask if someone's okay. If I know that Paulette just had surgery, I shouldn't ask, hey, Paulette, what do you need? Say, Paulette, I'm going to go ahead and drop dinner off on Thursday. Does that work for you? Because if you give people the option of, hey, how can I help you? They will never tell you how you can help them. Offer what you can to somebody who is truly in need. Reach out for more help if you're concerned. Take a mental health first aid class. We do have free classes sponsored by United Way coming up in both June and September of this year to help people gather the skills to know when do you really need to reach out for more professional help. And keep doing what you're doing. Keep supporting the community. Last year, your group gave us $1,000 and asked us to give it to someone who is in need. And we identified a single mom working 2 jobs, trying to go to school to become a CNA. And she received that money from Soroptimist. She was able to buy clothes for her kid. She was able to close the gap of being able to cover her childcare, and she used the rest of that money to support her education. So the work that you're doing right now is making a huge impact in our community. And none of us can do it alone. We're all in this together. And, we just try to be a part of that solution. We try to be a part of the community. We do our job pretty quietly behind the scenes. And, our job is really just to be there to figure out what supports do people need and to help get them connected. It's not always what we have to offer. We know that sometimes what people need is mental health counseling, is psychiatric med services. And sometimes what it's really about is just getting some sort of basic need met. And so our care coordinators and care navigators are out doing that work. We're working with law enforcement and fire and first responding. We're working with our internal team to track anybody that we have contact with that's going to the ER and finding out, hey, Jan, we saw you were in the ER 3 days in a row. What's going on? What do you need so that you don't have to get your healthcare taken care of there? So we're doing a whole lot of little things. And each of us, each time we show a little kindness, is doing something to better our community. And like that, I'll just stop talking because I've been talking at you guys and I've eaten up most of your hour. So any questions? Is your head full?
How do you coordinate with healthy families?
So Becca and I go to a lot of meetings together. And, when we have somebody who comes in with an acute sexual assault or domestic violence issue, we provide care jointly to that individual because that's really their specialty. So we do a lot of referrals back and forth between our organizations, and we are constantly, every once in a while, one of my staff actually was at the ER about 2 months ago with one of his male clients doing a rape kit. Sitting with him during that process, which typically we'd refer that to healthy families, but there was already an established relationship with our clinician, and it was that person's preference that we stand by as opposed to healthy families. But we're constantly referring back and forth, and we're part of this Sequim housing and I should know the name of it, something collaborative with the free clinic and the food bank and healthy families. And there's about 8 of us organizations that meet on a regular basis and are really trying to tackle those folks with the most complex and overlapping needs. And I see Natasha's hands up.
I had actually 2 questions. Is there another organization similar to yours that deals with the West End? Question number 1. And number 2, what sort of integration are you going to have with the new MAT clinic and that sort of thing? Thanks.
So West End Outreach Services is the community mental health provider out in Forks, and they serve the West End of Clallam and Jefferson counties, and they see about 300 community members a year. So they're a much smaller scale than we are. And we have a team of homeless outreach staff and our PATH and our real teams that are doing a lot of case finding out in the community and doing linkage into the MAC clinic in Sequim. So the Jamestown Healing Clinic. And I have been actually involved with the healing clinic since the idea was hatched, kind of in the background, meeting with Brent, the health director at the tribe. And our substance use disorders treatment program, as well as our homeless outreach program, are really going to be significant referral sources. But remember, that program is really only designed to serve about 200 community members. So we have a pretty small overlap in terms of that patient population. It's something like 15-20% of our folks. Most of the people that we provide substance use treatment service to have problems with alcohol and methamphetamines. So, and the Jamestown Clinic is really focused on opioid use disorder. So there's only a little bit of overlap, and then we'll get them into that program and we'll provide crisis intervention services, homeless outreach services. But the core of those individuals getting care there will receive all of their care at Jamestown, their dental, their primary care, and all their behavioral health needs. So we're really excited because that patient population, they're few in number, but they have a tremendous amount of needs.
Any other questions? Well, it is as impressive spoken aloud as it was on your website. It is just an amazing amount of services you provide. And it's just almost incomprehensible how much work there is to do and how much you're doing. So thank you.
Thank you, Kat. And I appreciate the opportunity to come share. Anytime we can help people know what we do, it helps you identify someone in your life who might need help that can get steered to that help. Because so often people say, I had no idea. I had no idea what happened in that big building on the corner of 8th and Lincoln.
Yeah. Great. Well, and good luck with your move.
Thanks. Moving's hard.
All right. Thank you so much, Wendy. I appreciate your being here.